David Hare joins me, Chief Executive of the NHS Partners Network. They represent private healthcare firms. David, very good afternoon to you.
Good afternoon, Ian.
So this £1 million, has that been on the increase over the years?
This is a very long-standing practice within the NHS that where there are capacity pressures, particularly over winter periods, the NHS will, in my view, quite sensibly make use of private hospital capacity to improve access for NHS patients, all paid for at NHS prices. So it isn't anything especially new. There's been a steady increase, but nothing dramatic. But I think the principle is a well-established and pretty good one, to be honest.
And what's the alternative?
The alternative is the NHS spending taxpayers' money, building new hospitals, increasing their own capacity, rather than making use of other capacity on a fee-for-use basis. I don't think the value for money of that would stack up. It would also deny patients the choice of treatment, which is well established in the NHS Constitution and a legal right that they have. So I don't think there is an alternative, but this is a simple fact that it has been done for decades, and I would expect successive governments to continue with the practice because it's right for NHS patients.
I have no idea how much a private hospital would charge for a hip operation, but let's say it's £5,000 for argument's sake. If that's the standard fee. If the NHS ring up a private hospital and say, look, we need you to do this for one of our patients who we haven't got a bed for, they need to come over this afternoon, do you charge the standard fee, or is there an excess charge for the fact that it's last minute?
One of the best-kept secrets, actually, about the way in which NHS funding works, and I wouldn't expect everyone for it to be the top of their bedtime reading, is that the amount any hospital has paid for NHS work is exactly the same. So there is a standard tariff for a hip procedure, a knee procedure, a shoulder procedure, and so on, which, if the patient is treated by an NHS hospital, is exactly the same as if they're treated by a private hospital. There's no difference in that fee. There's no surplus that's charged by the private hospital. It's exactly the same to the taxpayer and exactly the same options for the patient. So
when the BBC report this, and this is a direct quote from their story, they say NHS managers said money was being wasted as often it was done at the last minute and led to the NHS overpaying. From what you're saying, that's completely wrong.
It's completely wrong. The NHS will, when it outsources a patient or a patient transfers from the NHS into a private hospital, the private hospital will charge exactly the same as the NHS hospital would have done. There's no overcharging or overpaying in that. Similarly, when an NHS patient goes to their GP and chooses to be treated by a private hospital, as they have as a constitutional right, the amount that the NHS will be billed for that will be exactly the same in a private hospital as it would have been in an NHS hospital. These are long-standing practice and, frankly, good for patients.
Do you start tearing your hair out when you see stories like this on the BBC website? The headline is "Private Firms Cash In on an Overstretched NHS." The third paragraph was the one that I just read you, which you say is totally wrong. And, of course, the impression given is that somehow the private sector is ripping off the NHS.
It can be frustrating. It's similar, Ian, to, frankly, the debate about the privatisation of the NHS. You know, nothing is being sold off, nobody is being charged for their care, yet whenever a patient chooses to use a private company for their treatment, so there are cries of privatisation. I think that we need a much more grown-up debate about this issue. The NHS, since 1948, has been a public-private partnership. GPs are independent contractors for the NHS. Nearly a quarter of the NHS budget is spent on a private sector organisation in some form, whether that be GPs, pharmacy, private hospitals or others. It's actually about the quality of care that's delivered and the standards of that care that's delivered rather than who provides it, in some sense that because it's taxpayers' money or NHS money is flowing out of the public provider sector into a charity or a social enterprise or a private company, that is still consistent with the values of the NHS, which is free at the point of use.
But our previous guest was making the point that there have been quite a few examples of where private sector companies haven't performed properly, either in PFIs or in cleaning contracts, and of course that then it means that people tend to think that all private sector companies operate like that. That's quite a difficult one for you to get over, isn't it?
I think you've got to look at it all in context. There are tens of thousands of contracts that the NHS holds with private companies of some form, particularly if you expand that into cleaning and catering and construction and so on. Some of those will inevitably go wrong. Sometimes that's the fault of the contractor. Sometimes that's the fault of the buyer on the fault of the NHS for getting it wrong. The vast majority of those contracts are well managed. Very rarely, and I think quite rightly, would you hear the other argument in the case of, say, something like mid-staffed 10 years ago, which was a huge failure on behalf of the public provider sector, would you say, well, let's get rid of all public provision in the NHS because there has been a failure? I think people are more grown up about it than that.
Okay.
Pragmatic.
David, thank you very much. That's David Hare, Chief Executive of the NHS Partners Network.